Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Tuesday, May 19th. Let's begin with the 8 counties and look at the numbers from the hospitals in those counties of the capital region. As you can see on the vertical line with the blue bar, we have 113 patients currently in the hospitals being treated for COVID-19. That's a slight uptick from yesterday. In the ICU, about the same number, 21. You can see those numbers, Fred, have come down from the high water mark, and they're holding steady over the last couple days.
They are kind of flat. They are, which is good.
Inside here in the medical center, looking at our own internal numbers, we currently have 49 that we're treating for COVID-19. We have 41 on the floor. We have 8 in ICUs. We have 4 on ventilators. That's the lowest number we've had in quite some time. Fred, you spoke yesterday about people coming from congregate living facilities, which we define as nursing homes, group homes, those types of settings. And you shared with us the number of people currently we're treating here in the medical center that come from those settings. It got a bit of a reaction from people. They were interested in seeing the breakdown. So today, let me begin with the numbers. Of the 49 we have in the hospital, 35 of them are from congregate living facilities, and therefore 14 are from the community.
That's right. And we shared that information this morning on our call with the other hospitals in the region. And St. Peter's shared some numbers with us. Today they have 29 patients in-house, and 20 of their 29 are from congregate living facilities. So very similar. If you flip it around, we have 14 patients in-house from the community, and St. Peter's has 9. And when I say the community, I mean the non-congregate living facilities.
Right. Okay.
Important numbers.
Important numbers for sure. Speaking of numbers, as I mentioned, if you go out onto the internet, you can look up the statewide data. It's open source. And Fred and I were talking about some of the numbers today. Let me share at least a couple numbers that we were looking at to try to share them with you. When you look at, Fred, the people in New York State who have died from COVID-19, you can break that down a couple different ways. You can certainly break it down by age. If you are under the age of 29, 0.4%, less than 1% of all the fatalities fall into that age category. And actually under the age of 49, you can go up almost to the age of 50, 5.3%. So 95% of the fatalities are over the age of 50.
That's right. That's right.
And then comorbidities. Fred, what would be some examples of comorbidities that people have?
The most important one is high blood pressure, hypertension, diabetes. Obesity is a comorbidity in this. Yes.
And we're learning from the data that 90% of all the people who have died have at least one or more of those comorbidities. Right. So it speaks to the demographics of this disease.
And our results in New York State mirror what's happened literally around the world.
They do. So maybe we'll share some more data as we go forward. Again, speaking of data, healthcare workers who work at Albany Med who have tested positive for COVID-19. Let's update those numbers. The total number, Fred, is 104. How do they break down?
So 104 of about 1,000 tested, so a very similar positive percentage as the community in general. About 1/3 of them, again, were exposed to the virus somewhere in the organization, either through a coworker or a patient, but 2/3 of them were infected out in the community. And I think a very important number is 94. 94. And that's the number that have recovered and have cleared the virus and are back to work.
So you said a couple numbers there that are worth repeating. So you mentioned that we've tested 1,000, so that's about 10% of our workforce,
right.
And about 10% have tested positive, which you said is very similar. The 94 that have returned to work, they're not allowed to return to work right away. They have certain criteria. Right. We have them go home, wait till they have no symptoms anymore, fever-free, that type of thing.
Right. Fever-free, symptom-free for at least 72 hours and more than 7 days out from their infection.
The fact that we haven't had anybody test positive since May 8th, what do you attribute that to?
I think it's a number of factors. I think it relates to how good a job we're doing with PPE and preventing exposures in the organization. And I think there's also probably a waning of the infections that are happening in the community.
Well, congratulations to our workforce who's working so hard to keep not only the patients safe, but themselves safe.
Doing a great job.
Albany Medical Center has been asked to participate in a pilot that New York State will be doing. We appreciate the Hospital Association for New York State for reaching out to us and asking us to be part of that pilot. Fred, this has to do with visitors coming into the hospital. Let's remind people. So in the very beginning, when we started Incident Command, we restricted visitors into the hospital, and we have certain criteria as of yesterday, let's say, that people had to meet in order to visit someone in the hospital.
That's right. So very, very limited access for visitors. So some very compassionate circumstances, end-of-life kinds of circumstances, parents of ill children, and a labor partner for women in active labor. Primarily, that's it.
So to remind ourselves, 550 people in the hospital, let's say, 50 have COVID-19. Of those other 500, you could be in the hospital with a complication of diabetes, or you might have had a small heart attack. Those people are not having visitors as of yesterday.
That's right.
Okay.
No visitors.
As far as the pilot going forward, things are going to change a little bit.
That's right. So I think the state is interested in loosening up the restrictions on visitation. They want to do it in a controlled manner, and they want us to watch and see what happens. So there are a number of parameters that will get put in place. I'll just talk about a few.
Please.
So we'll open up visiting hours for perhaps 2 hours during the day.
Okay.
And we haven't decided upon which 2 hours, but we'll try to make that convenient for visitors. Visitors will have to be screened. They'll have to be screened like we screen everyone, temperature, symptoms, and they'll have to wear PPE. So a mask will be necessary.
Fred, would they be expected to bring that in themselves?
If
or?
they have them,
Yes.
we would like them, but if they don't, we'll provide
give it.
masks so they go on the floor. They'll have to hand hygiene. They'll have to engage in hand hygiene, wash their hands, which is a really important aspect of this. And if they're visiting a COVID positive patient, and right now today, virtually none of our COVID positive patients can have visitors.
Right.
That will have additional restrictions on the visitation.
All right, well, this is good because this will give us an opportunity to demonstrate that we can allow more visitors here, which we think is very important for health of patients to have some
Yes,
visitation.
it absolutely is.
And do so in a safe way.
That's right. And we'll do this for a while, track it, see what happens. There are going to be other medical centers around the state doing this as well, and hopefully this won't create any issues, and we'll expand even beyond that.
Very good. Finally, Fred, I know last night was our med exec. That's the organized medical staff, the way that they organize and do their work, and they wanted to talk about all the different protocols that have been put in place.
That's right. We had a discussion about PPE use and precautions, and the ask really was for us to put all the most recent recommendations together in a single source document.
Yes.
So Rebecca O'Donnell and Sarah Elmendorf and others have done that for us. It's a simple 2-page document. It covers precautions, PPE use, it covers serology testing as well as PCR testing for the virus. We'll send that out along with the email that this link goes out on, and we'll actually post that on the intranet. That's current recommendations from the CDC, the Department of Health, and the governor's executive orders as of today. And as those things change, which they will, we will update that document so people will have the most recent information. As we know it, they'll know it.
That's great. So a single source document, all the protocols, one place for our internal workforce so that they know where to go and what to follow.
That's right. We know things have changed over time, and at some points in this crisis very rapidly. We've been reactive, and we're going to continue to be reactive. We kind of have to because these changes are outside of our control, but we're going to try to do a better job communicating them.
That's excellent. Wow. As always, the medical staff is looking for the most information, and thank you to Rebecca and to Sarah and yourself and everyone else, Fred, for doing that. That'll do it for today. We'll be back again tomorrow. Tomorrow's Wednesday. Graduation from the medical school is Thursday of this week.
Yes.
And so we're going to be talking about our graduates of our medical school, and we look forward to that as well.
Yes.
We'll be back again tomorrow. We ask that you once again, please take care of yourself, take care of each other, and we'll see you tomorrow.